This person is missing half of their skull. And believe it or not, this type of procedure is a lot more common than you think. It's called a hemicraniectomy, and it's most commonly done for strokes, traumatic brain injuries, and hemorrhages. Neurosurgeons typically perform this procedure in an emergency situation. It could be done for a wide array of reasons, but it ultimately boils down to the brain needing more space. So as you can imagine, the skull is a rigid structure. So if there is an underlying pathology that is compressing the brain, you're going to need to make some more space for that brain to expand. Otherwise, it would be pressed up against this rigid structure. Now, I've seen other creators comment on this kind of thing, and they've called it a hemispherectomy. And I want to make it clear that this is not a hemispherectomy. This is a hemicraniectomy, which are two entirely different things. A common question that I end up getting is, what do we do with the other half of the skull? And the answer is that we actually place it underneath the fat pad inside of the abdomen. And after this procedure is done, we typically wait for the patient to recover from the underlying diagnosis. And sometimes it can take up to several months. During that time, the skull stays off and you allow the brain to recover. And sometimes they can be sent out of the hospital with a helmet just for protection. And when it's time to have the skull replaced, they come back to the hospital and we extract it from the abdomen and we replace it with metal screws and plates. So next time you see something like this, you'll know that